Our next presentation is Removing Barriers for Preventive Medical and Dental Care. Our presenter is Marie LaForce. She is Hennepin County Child and Teen Checkups. Welcome.
Hello, everyone. Let's see. So my name is Marie LaForce. I'm a public health nurse with the Child and Teen Checkups program. Today I'm going to talk about the Child and Teen Checkups program. There is a handout that's going around. Sue, are you going to hand out too? No, you got them all. Okay. So today, in addition to speaking about the program, I'm going to talk about eligibility both in broader terms locally and nationally. And I'm going to hone in on some of the details of the oral health components. Having a little trouble getting my slides to move. Yeah.
So you're just going to go like this. Oh, like that. Yeah, sorry about that. That's on me.
So when you leave today, you are going to be an eligibility expert, a support navigator, and a referral hero. So you're going to be able to define the quality, who qualifies for the Child and Teen Checkup program. You'll be able to identify the types of assistance that's available for the program. And you'll know how to make a referral no matter where you live, anywhere in the United States. So an expert, a navigator, and a hero. Not so bad. So let's begin with just a few statistics. So almost a quarter of children ages 2 to 5 have cavities in their baby teeth. Cavities are the most common chronic childhood disease. And over 200,000 pediatric emergency room visits are due to preventable dental conditions. So one of the ways that we work on this problem is trying to break down the barriers for children getting in for those preventative medical and dental appointments. So the Child and Teen Checkup program is a preventative medical and dental benefit. There are 2 components to eligibility. So your ears should perk up here so you can be that eligibility expert. So the very first thing is the child needs to be active on Medicaid insurance. Here in Minnesota, that's also known as medical assistance, or MA. The second is the child would be from birth up to age 21. So this program is for children who are active on medical assistance from birth all the way to 21 years old. Children are automatically enrolled in the program when they're active on medical assistance, and young adults are automatically disenrolled when they turn 21. We serve people in Hennepin County, although this program is available in every county in Minnesota and in every state in the U.S. The Child and Teen Checkup program is Minnesota's name for a federally funded program called EPSDT, which is short for Early Periodic Screening, Diagnosis, and Treatment. So some states have different names for the program. Florida calls it Child Health Checkup. Utah calls it Child Health Evaluation and Care, or CHEC. Indiana calls it Sunny Start. Iowa calls it Care for Kids. and Minnesota calls it Child and Teen Checkups. So many other states actually use the federal name EPSDT. So if you're watching online or you're seeing this as a recording, someplace other than Minnesota, EPSDT is required to be provided in every state in the United States. So this has been the development and the expansion of EPSDT over time. So Medicaid was first established 60 years ago. It was a part of a vision of Lyndon B. Johnson's called the Great Society. It was intended to reduce poverty and to increase access to health care. So that was in 1965. 2 years later, in 1967, EPSDT was introduced and became a mandated benefit on the Medicaid program. It focused on early, regular health screenings for children. A good 22 years later, EPSDT broadened to include treatment for those conditions found at those well child visits. So some states were doing better than others, and now with this expansion, comprehensive care was much more available across the whole country. In the 2000s, focus changed to improve outreach activities to increase participation rates. So for us, that includes talks like this, for example, so people can become more aware of the program. We also provide a lot of community outreach. And then in 2010, through the Affordable Care Act, EPSDT was reaffirmed as the pediatric standard of care. Medicaid was also expanded, and it increased the number of children and young adults who could access EPSDT, and care was provided to children without any fees to the family. So as of October of 2025, there are over 37 million children in the United States who could have access to this comprehensive coverage through EPSDT. And I say could have because there are a lot of children who maybe don't know about it. The parents aren't taking advantage of it because they don't understand. Maybe they don't understand preventative care. And that's part of the reason why outreach was really emphasized. Another impact that EPSDT has today is it allows for early detection of health problems, and it focuses on preventative care, which allows for early treatment while a problem is still small, and it reduces more costly care down the road. EPSDT is also a very important tool for leveling access to health care and for maintenance of good health for low-income children, so that children have a greater chance to thrive in their homes, to thrive in their schools, and also to thrive in their communities. So this is your first quiz. So when you leave today, I promise that you would be an eligibility expert. So there are two components to eligibility. Can somebody name one of them? Yes, enrolled in Medicaid, I heard. And what's the other one? Exactly. From birth up to age 21. So how often can a child go in for these preventative visits? So there are more frequent medical visits from birth up to 30 months old. There are a lot of developmental milestones during that time period. And then once a child turns 3, the visit is once a year, every year, through the age of 20 or up to 21 when they roll off of the program. And then in regard to dental, once that first tooth comes out from the gum, emerges from the gum, a child can go in for their preventative dental visits every 6 months. So let's get into a few specific examples so you can better understand early, periodic screening, diagnosis, and treatment. So early means identifying problems early. For example, the very first testing on this program happens at 24 to 48 hours after birth at the newborn screening called a blood spot test. This is through a prick in the child's heel. This tests for over 60 serious but treatable genetic conditions, such as sickle cell disease or muscular dystrophy, Duchenne's muscular dystrophy. As a result of this testing, treatment can start early because some of these genetic conditions don't have any symptoms. They don't show up until later down the road when a lot of damage has already been done. So early treatment and prevention can prevent or minimize disability, and it can even prevent death in some situations. Periodic means there are regular medical checks at important developmental intervals. For example, symptoms for autism begin to show around a child's development around the ages of 18 to 24 months. So there's a review of the child's development that might indicate a need for further screening if a child isn't meeting certain milestones. For example, does the child make eye contact with you? Does the child look at you when you speak to them? Or have you ever wondered if your child was deaf because they're not responding when you talk to them? So those 3 things may not indicate that your child has autism, but it certainly indicates that there should be further screening done to figure out what's happening. Screening includes a host of areas that require good health for all of us to be at our best. It includes physical, emotional, developmental, hearing, vision, an oral assessment at both the medical appointment as well as those 6-month checkups at the dentist, as well as other medical screenings to detect potential problems. So for example, referring to the medical assessment, there are head circumference measurements from birth up to age 2. Height and weight are measured from birth up to age 21. BMI is evaluated from age 2 up to age 21. And blood pressure is checked beginning at age 3 years old up to age 21. So the practitioner is looking for healthy ranges or looking for significant or concerning changes. Diagnosis is testing that measures both the child's wellness and evaluates when a health risk has been identified. An example of this is testing for blood lead levels. So testing is required 2 times. The first when the child is 12 months old, and the second again when the child is 24 months old. So low-income children may often live in older homes with chipping paint prior to a certain time period had lead in it because it helped with vibrant colors in the paint. Sometimes children in lower income families live by very busy highways, and back in the day we had lead in the gasoline, and the fumes would come up and it would settle in the soil, and that lead cannot be removed from the soil. And of course, one of the joys of childhood is getting out and playing in the dirt. So those are just two ways that children come in contact with lead, through the paint and through the soil. So lead testing is very important because the level of lead in a child's blood is only detected by a laboratory test, but it has very serious negative consequences in the child's brain development and their ability to learn. Treatment means initiating a plan to remedy a problem while that problem is still a small problem. For example, a child who is depressed would be referred to therapy. A child who has trouble pronouncing their THs or their Rs would be referred to speech therapy. And a child who is unable to see well would be prescribed glasses. So is there anyone out there who has either glasses or contacts that you're appreciating? I'm one of those. So this happens to be the schedule of what happens at the medical provider. So don't worry if you can't see all these details. What I wanted to show you is that this is a very comprehensive exam. And at each age, there are different components that are applicable. Some components are required that are shown by that solid black dot. Other components are recommended, and they're shown by that R on the schedule. And there are others where a risk assessment, which is often a questionnaire, is identified by the X. And the box highlighted in red shows the oral health component. That's required at each medical visit, starting at 6 months old. So this is what happens at the primary care clinic. Every medical appointment includes an oral exam that starts at 6 months old to check that first tooth, but it continues to follow every year after that. The practitioner lifts the lips and inspects the teeth and the soft tissues. Fluoride varnish is applied at every medical visit up to age 5. A verbal referral is required, suggesting the child go in for a dental checkup. This referral is required if the child and teen checkup exam is going to be complete. And if the exam is not complete, the practitioner doesn't get paid. So the dental referral starts at 6 months old when the first tooth erupts from the gums, but no later than 12 months old. So that's pretty much what happens at the medical exam with the primary care provider. So let's talk about what happens at the dental office. So the preventative dental benefit includes a visit every 6 months. So both at the medical and the dental benefits, they're free for the child and the family, so there's no charge for these. So the dental provider will assess the mouth, looking for oral growth and development. They'll assess for the risk of dental caries. They'll take x-rays as indicated. They'll assess if the child is drinking fluoridated water, or maybe if fluoride supplementation is needed. Health counseling will include good habits, such as brushing and flossing, a healthy diet in relation to the teeth, injury prevention, speech and language development, examination of any piercings, any non-nutritive habits like sucking on the fingers or a pacifier, and those would be encouraged to be weaned before this affects the teeth and the skeletal formation. The child's bite will be assessed. And the primary molars. So sealants can be applied in those pits and fissures that are very hard to clean with the toothbrush. And there are very high risks for tooth decay. Removal of third molars, commonly known as wisdom teeth, can also occur. So if a problem is found at the preventative dental visit, this can be submitted to insurance for prior authorization that's needed for the treatment. So let's talk about the services that are available through the Child and Teen Checkups program. So this will help you walk away as that support and navigator that we talked about. So I want you to pay special attention. So we tailor our help to each individual. At Hennepin County Child and Teen Checkups, as well as the staff in other areas providing EPSDT do, our staff helps find medical and dental clinics. We help make those medical and dental appointments. We will follow up with specialty referrals made as a result of that well-child visit when the child needs extra care, such as needing to go to the dermatologist or going in for a hearing test, or maybe I can't remember the dental thing I was going to say, but that dental thing. We can also help schedule specialty appointments when the family knows that the child needs to be seen. For example, like going into the ENT, the ear, nose, and throat practitioner. Or they need to go in for vision testing. So we can arrange for transportation and interpreter services for those medical and dental appointments. They're arranged through the health plan. We can also connect families with resources, such as the diaper depot that we have in our local area for discounted diapers and diaper coupons. So when you leave today, you will be a support navigator. So what assistance can a caregiver of a child in the Child and Teen Checkups program receive? Can you name one of those? And it won't be cheating to look on your paper, your handout. Anybody? What can you get assistance with if you're medical and dental, finding a clinic and making an appointment? Absolutely. Yes.
Arranging transportation.
Yes, arranging for transportation. Mm-hmm. Or interpreter services, yes. Yes. So I'll just bring those up. Assist with resources, make those specialty appointments, so we've covered all of those things. So last but not least, now for information on referrals. So in Hennepin County, our service hours are Monday through Friday from 8 to 4:30. We have someone on the phones who can assist either you or a caregiver. You, with the permission of a caregiver, can make a referral, or a caregiver themselves can reach us by phone or email or through our website. Our website has a link for online referral for assistance. For those who are not in Hennepin County but do live in Minnesota, in another county, you can call your county's local public health department and ask for the Child and Teen Checkups program. If you live in another state, you can ask your county's local public health department for the EPSDT program. And if they don't recognize EPSDT, you can search, maybe Google, what is your state's EPSDT program, and then when you call, use that familiar name. So this program is administered through the local public health department in your county where the child lives. So that's how you would make a connection. So the main thing to remember is this program is administered in the county where the child lives through the local public health department. So this is your final quiz. So after you leave today, you will know how to make a referral. So if you live here in Hennepin County or another county in greater Minnesota, or if you live anywhere in the United States, you can make a referral. So what is the local county department that manages EPSDT? Public health. Thank you. That's right. This program is available in every county and every state in the United States, and it's administered through the local public health department. So with that, I just want to open it up for questions or for comments.
I had a question. I'm just saying, we help lots of our patients with setting up interpreters and transportation. As a clinic, say, gosh, we would love some help with that bandwidth and kind of free up our staff. What would that referral look like, that partnership look like? Obviously, we'd have to know what county the child's living in. But, I mean, is it something like, hey, we've got an appointment with them for this date. Can you help set up a ride for them? Or what would that look like?
Yeah, so first is to remember the eligibility. So they have to be on medical assistance, yeah, and from birth to 21.
Yep.
And if they needed help with that, can I ask what your county is?
We serve like 77 counties, all over. So
Oh.
if I had patients, hey, I've got these 5 patients that meet your criteria, they have appointments in the next few months. they
Yes.
need transportation. Here's their info. Can you help set that up? Is that kind of what that handoff would look like? Or especially
Yeah.
if you have trouble getting transportation?
Yeah, so she's asking about how would a clinic get some assistance in setting up the transportation or interpreter services. Yeah, so you could, for example, if it was Hennepin County, you would just call our number and our staff would help set up those rides and that interpreter service. That would be fine, yeah. And so if you live, or if you're working in other counties other than Hennepin, you'd want to connect with the local public health department and check in with them for the EPSDT program in their area. Mm-hmm.
Thank you.
Yeah.
And is that just for their preventative visits, or if that child needs to come back, say, for treatment?
Mhm.
Does this cover transportation for those visits? I was a little unclear if it was just for the screening sealants, sort of, or if it was for treatment of C&TCs.
So the question was, do these services, does the transportation and the scheduling of appointments include when a child has to return? And so we are able to set up for specialty appointments, so that would be returning treatment, and the transportation is set up again through the health plan for those needed treatments. So there's transportation available. Yeah.
I had a question regarding language services.
Yeah.
Specifically for Hennepin County, I'm assuming it'll be different for counties. But for Hennepin County, if a family or a patient population doesn't speak English, do you have people on site that speak the most common languages in the county? Obviously, knowing certain counties are larger, as well as resources.
So the question is, what about people who speak different languages? So specifically for Hennepin County, we have staff on site that speak Hmong, Spanish, and Somali, but we also use the language line. So we have some staff who only speak English, and so we use the language line. And if a Somali-speaking staff has somebody who speaks Spanish, they'll use the language line, you know, so that's how we work that. Any other questions? Thank you.